For this week, I will discuss the correlation between your oral health and systemic health. We will go into what general inflammation is, the process, and why chronic inflammation is bad in your body and the impact that it has. We will then focus on your oral health and the relationship with heart disease. We'll move forward to talk about mental health and Alzheimer's disease and your oral health. Then pregnancy. We'll also talk about the importance of what I think is understated, but the importance of your mouth and gut microbiome and the relationship they have with one another and your overall health. And then we'll talk about diabetes. So the goal here is that we can talk about how important your oral health is and the impact that someone who does not have great health, the impact they can have on many disease processes throughout your body. So what I'm hoping is you can take away how significant your oral health is to the rest of your health and how important it is. My hope is that you take away with some great actionable information on why it's important to make sure you're staying on top of your oral health, your hygiene appointments, your home care, and everything around that. So please let us know if any questions around this, and I hope that you enjoy it. Thank you. Everyone knows the word inflammation. I'm not sure that all of my patients really appreciate what inflammation is and the implications of it. So we think of inflammation in the healthcare world as host response. It's the goal of your cellular processes in your body to eliminate infectious agents and damaged tissues. So if you think about, you have something that can be damaged through trauma and then infected through bacteria, fungus, viruses. The inflammatory process is essential for survival and for healing and regeneration of tissues. There are 5 classic symptoms or signs of inflammation, and that's pain, heat, redness, swelling, and loss of function. These were noted back in the first century. The classic signs to look for in any area of your body that when something is inflamed. It's the same process that happens for the most part, no matter where it occurs in your body or what the insult is that provokes this inflammation. The process is programmed through our DNA and the expression of the proteins that occur along with that process. So it's a protective system that can happen pretty much everywhere in our body. And that's why as we get deeper in this talk, you'll see there's a really large interplay between inflammation in one area of your body that then affects the rest of your body. Under normal conditions, and this is really important when you think about your gum tissue and your gum health, under normal conditions, your blood vessels only allow water and salts to flow through them. They're not terribly permeable. They're sealed off and they're protecting the incorrect flow of things. And so they're really protecting it. But when there's localized trauma to a tissue or an insult through to something like bacteria, virus, or a mold or a fungus, the blood vessels can actually change to become more permeable and allow protein-rich tissues and exudate to get in and out of the localized area. It's a really cool process, actually. If you were to look at your blood vessels when this happened, you have these like oval-like circles on a blood vessel. I remember learning about this in biochemistry when I was in college, and I was so fascinated by this process and the proteins that would come along to the blood vessels and make the tissue, the blood vessel change. So the blood vessels are going to dilate and also become more permeable to allow the influx of all the parts of our immune system that are responsible for inflammation. You have white blood cells coming from throughout the body to this local area, and they can actually ingest the bacteria and foreign particles. Once they're finished ingesting, that becomes exudate or pus for all the destroyed microorganisms. And then we need a place for that to get rid of. So our body will continue with the inflammatory response to clean up such processes. And about after 24 hours, the inflammation actually starts to change. And we'll get into that in a moment, acute versus chronic. But really what happens is the hallmark of this change, of this chronic inflammatory process, is actually what happens when we consider something gingivitis to periodontitis. And that's in my lane, dealing with somebody's mouth. And it can actually really change the nature of the area and change what happens to it over time. What's actually happening is your body is bringing monocytes, which you'll think about like stem cells, to mature into macrophages. And they're going to be the development of your immune system. And that's one of the hallmark signs of acute to chronic inflammation, is the change of the cellular matter and the type of of cells that come to the area to attack and clean up. One simple thing that you may notice about your gum tissue, and we have our patients notice it, when you're flossing, if you bleed, or if you're brushing and you bleed. So we talked about the change in the blood vessels themselves and their permeability. So if you floss an inflamed gum tissue and you apply pressure onto it, you're pushing on those blood vessels, and blood can come out. And because of the process of inflammation, the increase in permeability of the blood vessels, you can actually cause bleeding when you're flossing. So one of the presence of inflammation that we all look at is bleeding. When we're evaluating people, and you may have done it when have it done to you when you're at a dental appointment and they're calling out some numbers and they're checking the depth of your gum tissue. We have a mark on all of our charts, BOP, bleeding on probing. So you can, around each tooth, probe about 6 spots, and when you're evaluating somebody's mouth, you would note how many spots are bleeding throughout somebody's mouth on every tooth. So the more bleeding on probing, the more spots that are inflamed. Use that information to classify someone for the type of periodontal disease they may or may not have, and then make treatment decisions around that. Another component in the inflammatory response are prostaglandins, and this is a key component in the process. And what it's actually happening is to help to promote these blood vessels to become permeable and allow for platelet aggregation to the area. This can help to influence the heat in the area, or a fever in your whole body if there's enough floating through. And then also can help to feel some of the pain. So it signals of the pain to the area, and which can, of course, allow you to stay away from it, which is going to be protective to allow it to heal. Ibuprofen, aspirin, we call them NSAIDs, non-steroidal anti-inflammatory drugs. These actually can inhibit the prostaglandin process. It's good or bad depending. A lot of new positions coming out in healthcare right now about the use of anti-inflammatories. So there's been a shift in how you manage a fever. Leading to a podcast recently about someone, an expert in back injuries, and how one of the most important things is that they do not do anti-inflammatories when someone injures their back, because it'll cause a prevention in the proper vasculature that's needed when it actually prevents this process from occurring. So I always caution people about taking NSAIDs. I think that they're not necessarily the best medication for a lot of reasons. When you have injury, maybe turn to something like acetaminophen, a Tylenol, but let's not get too off topic here, but you can speak with your local, your doctor about things that happen to get more information about that. But get back focused here. To conclude, acute inflammation will allow damaged tissues to heal and to repair, and sometimes you'll get pus from that, and that's a normal process. But if it stays too long, it'll turn into chronic inflammation, and that is a complete change in the cellular matter that is attacking the area and trying to be protective. So part of the goals is to prevent it from spreading, the injury, the infection, the trauma, and to try to get regeneration of the tissue. So the process when it occurs to become chronic is when there's repeated acute inflammation in an area. So it turns to chronic, of course, because your body is trying to understand what's happening, trying to protect itself from that repeated insult. Whatever is causing the inflammation cannot be eliminated. So in my world, we can have somebody with a large cavity or a tooth that has had a nerve die, and your body is attacking the dead cellular matter, benefiting from a root canal. But those insults staying for too long will change the nature of the inflammation, and it'll become chronic. And we'll get more into why it's a problem for your whole body and the health of your major processes in your body. When there's an interference with the healing process, you can also develop chronic inflammation. So sometimes people have systemic issues with their immune system, compromised individuals, or you're just too busy, you're not sleeping enough, you're not taking good enough care of yourself, you're too busy working, traveling, and your body doesn't have the opportunity to heal because it's worn down. And then also when people have autoimmune issues where they have a less strong immune system, a weaker immune system, and then that could get activated, cause things like rheumatoid arthritis. So why is this a problem, and why do we spend so much time in healthcare talking and managing chronic inflammation? And the simplest reason is that it has a large effect on your whole body, and it actually can turn these cellular mediators can actually start to attack healthy tissue and healthy organs. And you'll see there's a development of disease processes that would not otherwise occur if these inflammatory cells were not present in your body. I'm sure most of you have heard about how chronic inflammation is correlated with heart disease, diabetes, cancer, arthritis, inflammatory bowel disease. So your mouth occupies about 30 square inches of space, of surface area. Your hand is 22 square inches, and so your mouth occupies more volume of space than your hand does. So appreciate that, and appreciate if your mouth is unhealthy or if you have chronic inflammation throughout a decent amount of your mouth, of how much of your body could be affected. So think about if half of your hand was inflamed and you were just walking around all day, every day with half of your hand inflamed, and what that would do to your overall health and how much energy your body would need to consume to try to maintain that and try to fight off what's causing the inflammation. How do we detect this in my world, and how do we work with our patients to figure out where they are at in terms of inflammation or non-inflammation in terms of health, and what we do about that? So, of course, we do our clinical exam on patients in terms of evaluating their tissue, as we spoke before, our evaluation of the gum tissue, our probing depths, checking the depth between the tooth and the gum tissue, what's normal, what's not normal, looking at the nature of the tissue, see if it's bleeding anywhere. And so healthy gum tissue is nice and firm, typically light pink or light brown, could be blackish depending on the amount of melanin. Stippled, the gum tissue typically stippled, and like I said, firm, and it cleanly follows the contour of your teeth. Now, unhealthy gum tissue is typically red, right, from the increase of the vascularity, the permeability of the vasculature, and it's puffy, shiny, and swollen. So it's not going to have this nice stippled appearance and following the teeth cleanly. It's going to be somewhat puffy and almost ballooned up. And as we spoke before, it bleeds when you touch it. Bleeding upon probing, bleeding upon flossing. When you brush, some people will call us up and say, hey, I've noticed lately I'm brushing and when I spit out, there's blood in the sink. Well, it's a really good sign of that your gums are inflamed. And this is the term gingivitis and periodontitis. So, I always laugh when I see commercials on TV of dental products and they're mentioning what they are and not really explaining what it is. So gingivitis is when you simply have acute inflammation that is resolvable by cleaning your teeth, removing the plaque and bacteria. And typically that's not when there's chronic inflammation, but when there is chronic inflammation, that's the term periodontitis. And in our literature, it kicks in somewhere around untreated gingivitis for about 2 weeks is the sign typically when things will shift in your mouth. So you can work together with your dentist, your hygienist to make sure that you're healthy, to see if there's any interventions that you need to have to manage inflammation in your mouth. And we'll talk about that more a little later. Okay, so we've established inflammation and some of the processes that occur from acute and chronic. And we have a little better understanding. We spent about 10 minutes talking about chronic inflammation, acute inflammation, a better understanding. Let's talk about the next level of it and just talk about inflammation systemically, what's happening, and how we test it in healthcare. So a blood test can tell your level of inflammation, and typically we're looking at a couple different things. It could be your C-reactive protein, right, your CRP, your homocysteine, your erythrocyte sedimentation rate. The two main things that people are looking at, though, are C-reactive protein and homocysteine. And so C-reactive protein has a process, has a hand in many of the process of inflammation. It's helping with your platelet aggregation, activation, adhesion, can activate leukocytes, the adhesion of leukocytes, cytokine release, infiltration, and all the different activities of leukocytes. So you can get different changes in your endothelium through your C-reactive protein, and also some of the changes in our blood vessels, growth of new blood vessels and stabilization of them, development of them, can all be activated through C-reactive protein. And it has a big hand. So that's why it's such a good measure of someone's inflammation. The more activity that's happening, of course, you're having more C-reactive protein. C-reactive protein is processed in your liver. And typically, a simple level of between 1 and 3 milligrams per liter of blood is showing chronic inflammation. It doesn't take a lot to show that you're having this simple. It really is an active part of the inflammatory process. We also mentioned homocysteine, and homocysteine is a type of amino acid that your body naturally produces. But again, once it starts getting too high, it can actually start to damage your blood vessels, encourage more clotting around them, and help to lead to heart disease. So these are things that when you go for your physicals are probably a good thing to check, and then you can figure out how to treat it depending on what's too high. I know a physician that follows homocysteine very closely, and one of the things that some individuals have a hard time breaking down homocysteine just because of their genetic makeup. You may have heard that some people are talking about it a bit on TikTok and such about it. So methylated folate, methylated B vitamins are a good thing to take if you happen to have the MTHFR gene. Like 44% of the population has that gene. I have that gene, so I take my B vitamin daily, methylated folate, methylated B vitamin, help break down my homocysteine levels if they're getting too high. Why does it matter? And how do we know that oral health affects your overall systemic inflammation? We can test that individuals that have had periodontitis, inflammation in their mouth, and have gone through treatment to resolve the periodontitis, they have lowered these levels of C-reactive protein and homocysteine. There's some literature supporting this going back to the 1980s. The team came across an article from 1987 that goes how your cytokine levels can change depending on your periodontal status. So this is something that we've known in medicine and in dental care for some time now. For those of you that are watching, you can see that if you're listening, you can go to our website and get all these show notes for free. They're available. And so I really like this figure here. And what it does is it's showing how an oral infection is related to systemic inflammation and a lot of the processes of other diseases that occur. So through your mouth and having an infection, bacteria can travel throughout your body and set off all different processes that then can further lead to systemic inflammation, and then along the line, like I said, go down the road and cause and influence some other disease processes, have a correlation with these diseases. Again, causality is hard to note, and we haven't really established it for many things, but there's a correlation between systemic inflammation, oral infections, oral inflammation, and a lot of the disease processes we're going to talk about today. Okay, so with that, now that we have a good idea of inflammation, some of the roles that inflammation has with our mouth and with our systemic health and how we can test it with our doctors, healthcare professionals, let's narrow the focus a little more for specific disease processes. And the most classic one that you've heard about is heart disease, your cardiovascular health and your oral health. I feel like most of my patients that I speak with know that there is a relationship between the two. I hear it a lot, and I'm happy that it motivates a lot of patients to follow through with taking great care of themselves. So commonly a patient will come in and say, oh, I recently had to start going to a cardiologist, and I realized that taking care of my mouth is really important because I understand there's a correlation. So let's talk about what's happening there and why has this become part of our culture in healthcare. So if bacteria are living around your teeth in the pockets of your gum tissue, or if you have cavities, the periodontal disease or the decay can help to influence heart disease. What's happening is the bacteria that causes decay or gum disease can actually get into your blood system. And then once it goes through the gum tissue into the blood vessels, this can get through your entire body and can get around your heart and your blood vessels. And this can happen every time you're eating, when you're brushing, when you're flossing, just throughout the day. Any movement of your gum tissue in that infected area, which you may not even know is infected, can cause this bacteremia to get into, throughout your blood. And so there's a lot of really good evidence to correlate periodontal infections, atherosclerosis, and vascular disease. We have established it in our literature, and the AAP, the American Academy of Periodontology, actually states that having periodontal disease may double your likeliness of having heart disease. So just having periodontal disease may double the risk. Double the risk is pretty strong influence. And this may be explained by some of the processes we spoke previously. So the biological mechanisms that are happening here, systemic inflammation, right, that's being caused or influenced by your oral inflammation and infections that are occurring, turn on C-reactive protein and other inflammatory mediators. This then can accumulate around your endothelial damaged parts of your body. Pathogens enter your bloodstream, invade your arterial wall, and then that causes more inflammation around that, right? This causes atherosclerotic plaques throughout your body, and that can help to, as you know, lead to reducing the blood flow of your vessels, leading to heart disease. So there's a pretty strong correlation of this process happening. The bacteria in your mouth can flow through your body also causing an increase in inflammation and inflammatory mediators that then can latch on to injured areas of blood vessels due to the bacteria through your body, and then perpetuate a actual plaque formation along with hypercholesterol, hyperlipids. So some really good incentives of floss. And it's really important that I note, and I probably should have said this earlier in the podcast, is most of the people who are walking around with periodontal disease do not know they have it. Most people walking around with tooth decay do not know they have it. And I'll have to get to this point more, and I should have said it a bit earlier, but you do not feel tooth disease, gum disease, until it's in the later stages. So we might classify something as mild, moderate, and severe. Very, very few people are aware of mild and moderate disease in their mouth. Most people are not. Most people are not. I could tell you, working as a clinical prosthodontist, most of my patients are surprised or annoyed, or surprised and annoyed, when we find things in their mouth. But that's part of why we exist. That's part of why we're doing thorough clinical exams. That's part of why we're taking radiographs. It's because we find things. We find things that you wouldn't know otherwise. And that's an important part of this process. Some people think they would know, right? Oh, I would know if I had this. And sure enough, there are some people who know, but those people are the minority of the population from what we find. We find that most people are unaware of moderate gum disease, of moderately large tooth decay. So that's just something you should be aware of, and why you should find and work together with someone you really trust, a great team. So I hope to inspire you. If you do not have that, find them where you are and find the right team to take really great, careful care of you, that you can partner with you so you can employ the strategies you may need to either maintain your current level of health or improve it from where it is. There was a really nice study that we came across that was published in February of 2022. This study is talking about is there a causal link between periodontal disease and cardiovascular disease? A concise review of recent findings. My team and I really love this study. It was a systematic review, and they isolated just about over 20 studies. And their statements, and I'll read them somewhat, is it demonstrates a firm association between oral health and atherosclerotic cardiovascular disease. They suggest periodontal therapy is associated with reductions in the markers for atherosclerotic cardiovascular disease, is what their finding is for the whole systemic review. This study broke their findings into 6 main categories. The first being atherosclerotic cardiovascular disease and periodontal disease. And as we said before, their summary is that there is evidence to suggest that cardiovascular disease is higher in patients with periodontal disease, exactly compared to patients without. The second was atherosclerotic cardiovascular disease and tooth loss, coronary heart disease, cerebral vascular disease, strokes, and circulatory mortality, and tooth loss. A little bit to say there, but their summary is that they found that the cause of tooth loss is unclear, but all the evidence suggests that people with fewer teeth are more likely to suffer from cardiovascular disease and actually heart disease related death. So I'm not sure what the correlation there is, but I'm sure it has to do with the general inflammation and the ability of someone to take care of themselves, how proactive they are, and the general process of disease occurring. Third was stroke and oral health related quality of life. As we go through this, you'll see is that oral health and oral disease has an influence on a lot of particular systems in your body, but it also works the other way too. If you were to have a stroke, that in itself is going to affect your oral health by loss of function and depending on your abilities when you do have that stroke to take care of yourself. The fourth is talking about cardiovascular disease and cavities and needing root canals, endodontic disease. And again, there was evidence correlating dental caries, dental infections, periodontal disease with cardiovascular disease. There's a direct correlation with people having one, have the other. Stroke and oral health promotion was the fifth. And again, thinking about the role both ways, and they found that patients who suffer from stroke, their oral health significantly decreases, which then perpetuates inflammation through their body. So it works hand in hand. It's this domino effect that's occurring. And then the last and quite significant and motivating to me for any of our patients is that cardiovascular disease and periodontal treatment. Periodontal treatment is, if you can think about, is a cleaning is essentially a periodontal treatment, a proper cleaning. Or when you have terrible periodontal disease, severe periodontal disease, or moderate, the therapies that a periodontist or your dentist would employ to help to manage the inflammation and resolve it. There is a firm association between oral health, periodontal disease, caries, tooth loss, and atherosclerotic cardiovascular disease, is what they found here. The statement is worth stating is that there is little or no evidence to support the link of oral health and other forms of cardiovascular disease that are as non-atherosclerotic, right? Which is interesting, right? Which is really stating the inflammatory process, which is really stating that the correlation of heart disease that occurs, the types of heart disease that occurs, are inflammatory processes that are related to the atherosclerotic plaque system that is interplaying with our bacteremia from our mouth. And I just think it's worth double clicking on that periodontal therapy is associated with a reduction of all the markers for atherosclerotic cardiovascular disease. So the way we measure certain diseases, you can correlate that with periodontal therapy, the markers for atherosclerotic cardiovascular disease, it will lower the markers. If you know your risk factors for your general health, I think it's fair to say most of us have a family member that is affected by heart disease, and ourselves maybe also being the number one killer here. I think it's motivating enough to do a great job to manage your inflammation. We talked about nothing else at all today. I think that in itself is enough to motivate you to take really great care of yourself when it comes to your oral health, to making sure you're cleaning between your teeth, flossing, water picking, whatever it may be, brushing properly, and checking in with really good healthcare professionals to make sure that you're doing everything that you can, or to change your techniques if you're not. So the next topic that we'll jump into is mental health, Alzheimer's disease, and oral health. We all have been affected or know someone who has been affected by dementia and mental health and issues around that. So dementia, as you know, is a chronic or progressive disturbance in the higher cortical functions, memory, thinking, orientation, comprehension, someone's ability to learn, language, judgment. The common causes of dementia are Alzheimer's disease and vascular dementia. Age, hereditary are primary risk factors. Some of you may have seen this show on TV, on Apple TV. I think it's on, no affiliation, of course, Limitless. And that's one of a famous actor, I think Chris Hemsworth maybe, has 2 ApoE4 genes, which gives him a much higher risk for Alzheimer's. And so the goal of the show was him doing things around his health to try to help lower his risk. There are things that we can do. So you can find that out. A lot of the genetic online test things like 23andMe, again, no affiliation, will tell you your ApoE4 status. So it's worth knowing, maybe. So then you can figure out what your risk is and then have some behavior changes around that. And so some of the factors that are correlated with Alzheimer's disease: hypertension, diabetes, hyperlipidemia, cognitive activity, your social activity, exercising, alcohol use, smoking, they all play a role. And there are numerous microorganisms suspected in triggering the inflammatory response in beta amyloid. This is a slow chronic process, and it is estimated to take up, somewhere around 20 years for symptoms to appear. A lot's unknown. There's some good literature here that we're going to talk about now that is something worth thinking about. So the effects of dementia and Alzheimer's disease on oral health is quite obvious, right? People who are developing the disease have a greater need of dependency on those around them for oral care, for their daily hygiene, for their daily care. They lose the capacity to clean their teeth. They lose the ability to keep track of the regular hygiene at home. So there, of course, are studies showing there's a direct correlation of individuals with dementia having a greater degree, higher levels of periodontal disease, tooth decay, and as cognitive impairment develops, so does the level of health starts to go down. And so we in our practice, of course, take care of patients who start developing this disease, and quite honestly, it's somewhat heartbreaking to try to help them and maintain them. And sometimes no matter what efforts we employ, it's a losing battle. These patients' inability to take care of themselves, and it becomes really, really hard on those around them. So trying to find leverage through this talk for people to make sure they're taking great care of themselves, and the role of your oral health on developing dementia maybe can help you think about how well you're taking care of yourself and employ some resources towards that. And so with that, let's talk about the effects of oral health on Alzheimer's disease and dementia. And so again, periodontal disease is an inflammatory process, as we spoke about. Cytokines, inflammatory mediators, can increase your cerebral inflammation. Periodontal pathogens, especially P. gingivalis, which has the same name as gingivitis essentially, has directly been linked to Alzheimer's disease. And for patients who have died with Alzheimer's disease, this bacteria has actually been found within their brain tissue. The pathogens of periodontal disease can actually cross your blood-brain barrier. So as we spoke about earlier, that if you have periodontal disease inflammation and you're cleaning your teeth, you're eating food, you're talking, and you're causing some bacteremia, bacteria to go through your blood system, that bacteria can flow into your actually brain tissue. A study of clinical and bacterial markers of periodontal disease and their association with incident of all-cause and Alzheimer's disease dementia in a large national survey. This was done in 2020, Journal of Alzheimer's Disease. And I'll read you what they said. Among those 65 and older, both Alzheimer's disease diagnosis and deaths were associated with antibodies against the oral bacterium P. gingivalis, which can cluster around other bacteria that exist and further increase those risks. Pretty clear correlation between oral disease and Alzheimer's in what they found. Another article that was published in 2021 reviewed 5 articles, and they concluded on their review that there is a link between periodontal disease and Alzheimer's disease. Periodontal pathogenic bacteria have been found in plaques of Alzheimer's disease patients. There's not specific methodology on this, and the direct correlation has not been established, right? We can't say there's a direct cause happening here, but we can definitely say that there is influence and there is a correlation. The direct action, aside from the bacteria being found, further studies need to be done for that, but we can at least say that there are risk factors that exist that gives us enough information to say that there's a correlation between oral disease and Alzheimer's. So with that, let's jump into the correlation of systemic health, oral health, in terms of pregnancy. I feel like this is a pretty well-known area. A lot of our pregnant patients are really good about coming in during their pregnancy for their hygiene visits. And so, as you know, as everybody knows very well, you're going through hormonal changes through pregnancy. This can actually increase your risk of gingivitis. In the presence of plaque and increased hormones, that you can have a higher rate of inflammation. So individuals that are pregnant need to be a little more meticulous than normal, possibly. They are already meticulous about their oral hygiene and their plaque control, because less plaque can provoke a more profound response than you've ever experienced in your life. And so brushing and flossing very routinely is so important. No, it may be hard, may be difficult, not feeling so well. Your body's making life, thank you. But nevertheless, flossing possibly twice a day and brushing 2 to 3 times a day is probably a pretty good idea here. Because of the inflammatory process being heightened, we have seen patients, and we have had patients with actually what's called a pyrogenic granuloma, which is a vascular benign tumor that grows as a result of plaque and the hormonal changes. This resolves after pregnancy. I've had some patients have to have them surgically removed during pregnancy to become painful, and somewhat they bleed a lot. There's no downside once pregnancy is over, but it's something to think about that you could be at risk for and pay attention to. The other part of pregnancy that some people know all too well is they're nauseous, morning sickness. So vomiting can increase the amount of acid in your mouth, which of course can erode your enamel and creates an acidic environment, which allows the bacteria in our mouth to grow and breed more. One thing you want to do is if you're suffering from morning sickness and vomiting quite a bit during your pregnancy, is do not brush immediately. Your mouth is so acidic, if you brush, you're actually be kind of hurting your teeth in that process. So a simple trick is to take some water and throw in a teaspoon of baking soda, maybe a cup of water, a teaspoon of baking soda, and rinse with that. Popular right now is alkaline water. Rinsing with some alkaline water is another simple way to help to neutralize your mouth, and then brushing a little while after that is a really good strategy. So you want to keep your cleanings and your exams as normal. X-rays are considered safe. You can place the barrier over yourself when you're pregnant. Radiographs are considered safe. You might see that just recently the ADA has lifted the use of these lead gowns for dental radiographs, because now we're using digital radiography, so the radiation is extremely low in any regard, especially compared to what it was before that. So we've actually removed the lead gowns. You can see there's not one in this room. Just so you know that if you're having an issue, to not be so concerned about that. And elective treatment can be postponed, of course. That's one thing that we typically do, because you don't want to do anything that you don't need to do while pregnant. And also, if any anesthesia is required, typically try to use that in the second trimester. Some anesthetics have epinephrine in them, and closer to pregnancy may help upregulate your system and provoke things. So treatment that needs to be done, like everything else, and most people know this, is you want to have that done during the second trimester. Your effects of your oral health on your pregnancy, adverse pregnancy outcomes have included to be preterm births, premature rupture of membranes, preeclampsia, miscarriages, low birth weights, stillbirth, have all been related to have oral disease. Numerous studies show that there are adverse pregnancy outcomes in the presence of periodontal disease. So increasing the severity of these diseases in your mouth are related to adverse pregnancy outcomes. The two major proposed mechanisms regarding periodontal disease and adverse pregnancy outcomes is, one, the direct migration of oral microorganisms or their components into the actual fetal placenta, and then also inflammatory mediators being produced in the oral cavity and systemically that then can adversely affect the fetal placenta indirectly. So the bacteria and other organisms themselves, or just the result of inflammation. And this is the theme through all these processes in our body. All these disease processes we're talking about, you'll always see this on every note. It's the same issue contributing to it. So it's something that is controllable, and you can take this risk factor off the table. With proper home care, the proper dental team around you, you can take the risk factor and the correlation of all these diseases off the table for yourself if you manage your oral health properly. We can take it a step further. We've then taken patients, and there's a systematic review around this, taking patients who are pregnant with periodontal disease and treating their periodontal disease during pregnancy. And so this has been found to reduce adverse pregnancy outcomes if you can manage the inflammation and periodontal disease during pregnancy. There's a systematic review evaluating 19 randomized control trials for about 20 years, 2000 to 2018, and this is quite interesting. And it suggested that although non-surgical periodontal disease did not completely avert the occurrence of adverse pregnancy outcomes, it could be recommended as part of the care. And so when someone goes into pregnancy with periodontal disease, the results of that can be so significant that treating it completely during pregnancy has not completely lowered the risk. So I guess this has to say, if you are going to try to start getting pregnant, it's great to make sure that you get your oral care in control prior to your attempts and prior to getting pregnant. You should still treat yourself and your gum disease during pregnancy if it happens to be there, but just know that the significance of the chronic inflammation is so profound that treating it during pregnancy has not completely resolved the adverse outcomes. It almost makes it too late in a way. Good news is there are a few other things you can employ: vitamin D, omega-3, which are becoming a lot more popular now too. A lot more information coming out, but these, taking regular vitamin D and omegas, have helped periodontal patients, have helped lower the risk for adverse outcomes for people who have had periodontal disease or have it during pregnancy. If you know someone trying to get pregnant, or you yourself, maybe trying to get pregnant, it's a great idea to see your dentist, see your hygienist, and get really good habits before you get pregnant, because I'm sure it won't get easier. I know it doesn't once the kids come. I'm not sure anything gets easier once your kids come. I know I have 2 children and things are not easy. So let's jump to gut health and oral health. Oral bacteria can migrate into the GI and contribute to GI disease. Same theme through all these processes. This is a more direct route, right? My team and I are talking this week actually about our role with our patients with their gut health. We at our practice have our patients use an oral probiotic, not a pill that you swallow, but a lozenge that dissolves in your mouth to help repopulate your mouth of healthy bacteria when we do at every cleaning. And we're talking about how do we talk with patients about the role of their oral health and the microbiome. Microbiome is getting a lot more attention. I see people talking about it on TikTok and on Instagram, a lot more posts around this, which is good, which is great. People becoming more knowledgeable about the role their gut health can be really impactful. How much of our immune system comes from our gut health and the other parts of a disease process that can occur if our gut is having problems. So the one way that bacteria can travel to your gut is quite obvious. You swallow. So if you have an increased rate of bacteria in your mouth, every time you're swallowing, every time bacteria is traveling down your GI tract and ending up through your intestines, and they can infect your area. The other is the same route we spoke about through your blood, through the bacteremia, travel through your blood bacteria and can locate at different sites along your body, and your gut is also one of them. So when you are swallowing bacteria, they can rarely actually reach and colonize in a healthy gut. So if you do have a healthy gut, swallowing bad bacteria will hardly ever have an impact on it. But when you have a GI tract that your microbiome is disrupted, it could be from alcohol use, it could be from taking an antibiotic, it could be that you're sick, it could be that you've suffered some type, you're eating something, not sleeping, traveling, being worn down, and the microbiome of your gut gets altered, and then you end up swallowing some of your inflammatory bacteria that is in your mouth. That can then cause opportunistic infections in your GI tract. Even things as simple as artificial sweeteners can disrupt your gut microbiome. Food additives can disrupt your microbiome. So I do think speaking with your healthcare professional about the use of probiotics could be helpful. We have patients, like I said, take oral probiotics here at the office, but we also work with them about taking oral probiotics at home nightly. I know I do. I take an oral probiotic nightly. I take I take GI probiotics during times when I need to, like alcohol use. If I did have to take an antibiotic, which I luckily don't have to do often, or if traveling, eating different food, I will take a probiotic for my GI tract. And I do nightly use an oral probiotic. And that's the last thing I do in my home care routine. And a bunch of us here at the practice do that. So we clean between our teeth, water pick and flossing. If you're a pro, you're going to use both. Not mandatory, but probably a good idea. And then you're going to brush. And the last thing that we're going to do is take that oral probiotic and let the lozenge dissolve in your mouth. We like in the practice Burst. Burst makes a really, I think there's one here, but Burst makes a really nice probiotic. There's more strains of bacteria in their probiotic than most of them. We have no affiliation. We buy their product. And I buy my product at home myself, and I really like that product. But that's the single one we suggest to our patients. So no affiliation with them directly. I just think they're a really great company for their probiotics. They have some nice other products, but let's just focus on that. So if you may be a person who suffers from heartburn and you medicate that, so you're medicating the acid to be decreased in your stomach, and so this acid decrease can increase the likelihood of oral bacteria from thriving and colonizing in the gut. Makes it a more comfortable place for the acid to live, actually. So we have a really strong interplay between the bacteria in our mouth and our gut. Inflammatory bowel disease, recent studies showed that the bacteria that reside in our saliva can actually elicit a response of the bacteria that colonize in our gut. There can be some type of communication that occur between them to help accentuate them, accentuate the disease in your gut. And then we've also found that the oral microbiome changes in patients who suffer from canker sores. So the area around the canker sore, the actual microbiome in that area changes to be an unhealthy balance versus the other areas of your mouth when you're not suffering from a canker sore, actually compared, which is pretty interesting, right? Non-inflamed mucosa does not exhibit this impact in their microbiome, but the inflamed aphthous ulcer or canker sore area actually shows another reason why a probiotic might do some benefit for everyone. We'll put up a really nice figure here that shows how oral bacteria can be detected in your blood circulation and then also detected in the gut. And you can take a look at it and see how there's a nice figure to show how your mouth, stomach, and your intestinal tract are influenced. Again, we go through taking a proton pump inhibitor to lower the acid level that then allows for more of the oral bacteria to be detected in your gut and proliferate, causing inflammatory diseases there. So I think we have enough reasons to consider the correlation here and also give us enough leverage for taking really great care of ourselves and flossing and all that. And then so with that, we'll jump into the last of the areas we're looking at here, and it's diabetes. Diabetes is one of the largest risk factors for dental surgeries and healing and dental implants. In the normal healthy individual, the success of a dental implant is somewhere around 97%. Now it ranges where you are in your mouth and the situation and the bone density, but across the board, we're about 97%. In individuals with diabetes, it's an 80% success rate across the board. Well-controlled diabetics have a higher rate, but nevertheless, we're looking at the groups as a whole, and people with diabetes have such a reduction. And there's not a larger reduction in the success of dental implants in any other area than diabetes. The direct causality, like many of these processes, is unknown, but we can definitely identify the correlation and numerically assign the reduction of success around that. So people who are losing, if you've lost a tooth or someone you love and they suffer from diabetes, you really want to make sure they're working with their endocrinologist to have things controlled as well as possible. And it's a lot easier than it used to be, right? We have CGMs today, and people can really monitor their blood level throughout today better than ever before, tied to their smartphone, and you can monitor your blood sugar levels to make sure that you're keeping your glucose levels controlled. The problem with diabetes, we find that people suffer from dry mouth, right? You produce less saliva, and then also you have glucose in your saliva. Higher blood sugar can weaken your white blood cells, can lessen your body's ability to fight infections. Gum inflammation is more likely to occur, and you're having a slower rate of healing. So we have this multifactorial issues that are occurring that really affects your oral cavity quite dramatically. Like I said, almost more dramatically than any other things that we have. The actual disease process of diabetes affecting the actual health and success of things in your mouth. Gum disease can be more severe because of this and can take longer to heal because of this. Infections in your mouth, delayed healing responses. People with diabetes are more prone to fungal infections because of the reduction in saliva and the lessening of the immune system. And so this has been well published, and the correlation between diabetes. And so we want to, again, make sure that we're working with our patients. You're working with your healthcare teams to control both your oral disease and diabetes, if you have it, and the interaction between that, just to establish the role that they play. And so that's kind of to wrap up our whole talk here about the relationship between our oral cavity and our systemic health. We can see that it's extremely well established. We work with our patients to figure out the best way for them to clean between their teeth, to brush their teeth, which toothpaste to use, which mouth rinses to use if they already use them, Like I said, we're huge advocates of oral probiotics. No downside aside from the time and cost that goes into it. And I can't emphasize enough of having the right team around you to really give you the strategies to take care of yourself, to diagnose things that you may have, and to treat what's necessary the right way, to not treat what's not necessary, to work as your team. So I hope I gave you a good foundation and a good understanding. Try to go a little deep in some of it, but not too deep to the true physiology and biochemistry, that we're not going through cellular biology here, but enough to give you a real understanding of the process in your mouth. Thank you for joining us this week. I hope you found it helpful and enjoyable. Please head to our website for our show notes and more information around the topics we discussed today. Please check us out on our YouTube, Instagram, and TikTok pages for weekly updates and other interesting topics we discuss more frequently. The information provided in this podcast is for general information and educational purposes only and is not a substitute for professional advice. Accordingly, before taking any actions based on such information, we encourage you to consult with the appropriate professionals. We do not provide any medical nor health advice. You should seek the full diagnosis and treatment from your healthcare providers for any issues or conditions you may have. No doctor and patient relationship is formed. The use or reliance of any information used from this podcast is solely at your own risk. This podcast is purely for educational and informative purposes only.